before you think about this as your graduate program, know that you really need to be all in, because just the amount of time it takes, there's a lot of knowledge you need to stuff into a short amount of time. So it's the reading, it's the preparing before class, it's the participating in class, but it's also the time you need to spend in clinical, because this is not something that we can schedule 6 births so you can put in your 12 hours. It's a lot of time you spend. You spend a lot of time with women. Sometimes you labor with a woman for 12 hours and the birth doesn't happen while you're there. And so it's a lot of time, and it's a huge commitment. And that's what I would want people to be ready for, is the commitment, and then the lifetime commitment, because it's also a lot of times not just a 40-hour-a-week job. And be prepared for being up at night, because that's what being a midwife in full scope practice where you're attending births is about. Well, graduate school there's always core courses, and there's, those courses that you really need as a foundation. So those classes are the pathophysiology and the pharmacology and health assessment, and those really have to come at the beginning, so you lay down that foundation for your clinical courses. So depending on whether students opt for the more full-time program versus a more part-time program, they're going to start their clinical either the second semester or the second year that they're in the program. The core courses are taught, a lot of them in a blended way, so you might be on campus for some of the time and more of a distance. But once you're in the clinical courses, they are on campus, although we really try to minimize the number of days you're on campus. So they're going to be long days. You're going to have probably 3 different topics with 1 or 2 guest speakers, and then some time in the simulation lab where we practice skills we've been talking about, you've been reading about as a student before you go off into clinical. And then there are those sorts of things that you don't necessarily experience when you're in clinical, such as like a breech birth, that then we'll go back and do in simulation. So we do a lot of clinical skills practice. Our simulation does not replace our clinical experience. So there is a lot of clinical, and that's really, I think, where students put it all together. Well, I would say that most of the graduates end up in full scope practice. So what that means for a nurse midwife is you are seeing women in the clinical setting during their pregnancy, non-pregnant for primary care, for well woman care, and then you were also in the hospital with women during labor, during birth, after birth. So that's where most students first start off, because they really want that full scope experience. We have some graduates who will do more of an ambulatory care setting, like Planned Parenthood, where they're doing annual exams and family planning for women. And then, we have some that will go on to faculty positions. Well, we don't have a large program, which is nice. The program has grown, which is great. I think the more midwives we have, the better at this point. But our program is still fairly small, and it's not going to get really large because of our commitment to clinical experiences and clinical placements. So that means that, of course, we know all the students by name. We have interviewed every student, so we know your name before you get there. We meet as faculty at least once a month. We are committed to somebody being available should you need to meet with us. And we also really try to provide opportunities for students to get to know each other. A lot can be gained by learning from students maybe that are the year ahead of you. So we do things like cookouts or just some social activities. I think, our faculty, and I'm not just saying that because I'm part of the faculty, but, we're all doctorally prepared, but we also all work clinically. And I think that makes a big difference. Students will say that makes a difference. We come to class with the stories from clinical as well as the knowledge we got during our midwifery program and our doctoral program. And, University of Michigan has such a good foundation of, just the library resources. And, for me, a big part of why I'm at University of Michigan and why I know a lot of students choose University of Michigan is for the global opportunities, because we do not only clinical immersions globally, but we're also going and doing community education and midwifery and nursing education globally, and students are always involved in that. And I've been able to take students with me to Myanmar and Uganda and Haiti, and that's really a huge part, I think, of what makes University of Michigan different.